Alright, so the doctor has now ordered that I discontinue the IV. So I'm going to the patient's room, introduce myself, wash my hands. I am then going to explain to the patient what I'm going to do. So I'm going to make sure that I close all of the locks on the IV. I'm going to be documenting the time that I stopped when I discontinued. And when I remove this, I'm going to do a flush of 5 milliliters, normal saline. I've taken this out. The whole time when I document, I also want to make sure I do my other 5 rights along with documentation, right patient, right med, right dose, right route, and right time, because I'm going to give the Dilaudid. So I dispose of that correctly, and I'm going to flush, make sure that this is good. I'm going to flush 5 mils. And now that I have that flushed, I'm going to check how the patient's doing and explain that I'm going to be right back to come give him his Dilaudid. So I go to the med room now and I review the orders, check the MAR, and I'm going to get my medication. This is the Dilaudid vial. And I'm going to make sure that I use my alcohol swab, cleanse the port, and I'm going to drop 1 milligram of So once again, this is the Dilaudid. I'm going to mix it with normal saline. My patient seems to be in quite a bit of pain, so I'm going to give the 2 milligrams of Dilaudid. And in order to do that, every 1 milligram of Dilaudid has to have 2 milliliters of normal saline. Since I'm giving 2 milligrams of Dilaudid, I'm going to give 4 milliliters of normal saline with that. And I'm going to drop 1 milliliter of Dilaudid because that's the conversion. So I'm going to take my alcohol swab and I'm going to cleanse the port. I'm going to, and once I put this in here, I have to make sure that I get just the exact amount. That way I can't push it back in. So putting in before I do that, I actually have to add in Before I draw my Dilaudid, I'm going to add 4 milliliters of air into my container of normal saline. That way I don't have create not equal pressure. So I'm going to put that in there. And then I would have swabbed it first. And I'm going to then drop my 1 milliliter of air for my Dilaudid, cleanse the port, insert in my needle, insert the air, and I'm going to withdraw after I've shaken this, not shaken it, but rolled it in my hands, making sure there's no cracks or anything, making sure it's not expired. I'm going to withdraw 1 milliliter of solution. I'm going to cleanse the port to this one again, and I'm going to draw up 4 milliliters of normal saline. I have to make sure that I don't go above because I don't want to push it back in. So in total, I'm going to have 5 milliliters in the syringe. And now that I'm getting closer to the 5, I'm going to go slower so I don't miss it. And I'm at 5 milliliters. I'm going to recap my needle safely. And then now I'm going to go to the patient's room, knock, introduce myself, wash my hands, get my gloves on. I'm going to talk to the patient, explain the procedure, And I'm going to then administer the medications. And actually, I would have taken my needle and disposed of it in the sharps container because I'm going to use the Luer lock to to administer the medication. So I'm now going to get my alcohol swab and I'm going to cleanse the port. And I'm going to flush 5 mils. And my IV is still intact because I'm going to pull back for blood return and flush. And now I'm going to cleanse the port with a different alcohol swab. And I'm going to administer my medication. And when I administer my medication, I want to do it slowly over a total of 4 minutes because I added the 2 milligrams of solution. So this would be a good time for me to check with the patient, make sure that there's no redness as I administer the medication. Kind of just catch up with the patient. And so I'm going to administer this over 4 minutes and dispose of correctly. And I'm going to then flush with another 5 mils after I cleanse the port one more time. And I would have checked since I used a new flush, I would have checked it. And then I'm going to check how the patient did. I'm going to make sure that there's no redness, swelling, anything like that. I'm going to go document, make sure I identified my patient using 2 identifiers when I came into the room. And now, once again, going over my 6 rights, my right patient, right med, right dose, right route, right time, and then documentation. And yeah. Now the doctor has ordered a discontinuation of IV infusion after I just administered that last dose of Dilaudid and Clavurin. So I'm going to go to the patient's room and remove the IV. I get to the patient's room. I'm going to knock, wash my hands, introduce myself. I'm going to put gloves on. I'm going to explain to the patient what I'm going to do. Identify him using 2 ways. And then I'm going to do my 6 rights, right patient, right med, right dose, right route, right time, documentation. And then I'm going to remove his tape so I can easily pull out the IV catheter. And making sure that I hold the skin as I do this so I'm not hurting the patient. Alright, and now that I have all of the tape off the patient's skin, I'm going to get my sterile gauze and I'm going to hold it over the insertion site and I'm going to then pull out the catheter and put that in the correct disposal. And before I dispose, I'm going to make sure that I assess the catheter, that there's no barbs, there's nothing broken, nothing bent. If it's bent, then assess that. And then I'm going to apply pressure for 2 to 3 minutes. And at that time, I'm going to then have my sterile gauze. I'm going to create a bandage and take my tape, and I'm going to set that on top. And then I'm going to check how my patient did. I'm going to go document the 6 rights, right patient, right med, right dose, right time, right route. I'm going to document how the patient took it, document if there was anything wrong with the catheter, and any excessive bleeding. And that is the discontinuation of that IV. All right, and now I'm going to go back in when I'm checking on the patient. I'm just going to make sure that there's no swelling, redness, and that everything is going okay for the patient that I just removed the IV on.